India has reported more than 20,000 new coronavirus cases for the first time, taking the country's total to more than 625,000. Almost 380 new deaths have also been recorded. Now, the surge comes just as India opened one of the world's largest hospitals to combat COVID-19, the size of 22 football fields. 2,000 of its 10,000 beds are available for use. The facility is expected to be fully operational by Sunday. Ishan Garg is in New Delhi and he joins us now. Ishan, so staggering figures out of India. How is the government addressing the surge?
Well, Glenda, as counterintuitive as it might seem, the government is actually planning on reopening the Indian economy even further. The government is going to relax more rules. The travel restrictions are going to be relaxed even further, and more businesses will now be allowed to resume functioning. Now, this is a sentiment that Prime Minister Narendra Modi himself and our Health Minister in India, they have said it so many times that while people need to take necessary precautions, like they need to maintain safe distancing, they need to put on a mask every time to get out, and all non-essential travel should be avoided, but at the same time, people now have to learn to live with the virus. Now, as far as the possibility of another lockdown comes, because that's something that experts have been saying, that as the cases go up further, another lockdown must be imminent. Now, that responsibility has been passed by the federal government to the local government. So we are seeing state governments and even municipal governments in cities imposing a lockdown upon themselves, despite there being no in spite of there being no federal order. So we are seeing larger cities in South India which are observing somewhere a single-day lockdown. Some other cities have gone into lockdown for a much longer period of time. So we are seeing that there is no wider national policy by the federal government on controlling the virus. The policy now seems to be on containing the spread and expanding testing. So that's where we stand. The local governments are trying to curb the spread, while the federal government is ramping up testing and contact tracing.
Ishan, how far will this new hospital in New Delhi go to alleviate the city's overwhelmed healthcare system?
Well, a hospital of this size and the capacity that it has, when it's completely full, it will be actually able to take in about 10,000 patients. A facility like this was the need of the hour. Not only are the cases in India increasing overall, Delhi particularly is hit really bad. Delhi actually right now is the biggest COVID-19 hotspot in the entire country. And the Delhi government taking the initiative to build a facility like this could serve as a model for other states as well. We are seeing several developments like this in cities like Mumbai, in cities like Bangalore, which also have a higher caseload, and they are also transforming these private infrastructure centers into COVID-19 treatment centers. The people of Delhi will be better off once the facility is complete, because right now their only choices were going to either a private hospital where they would be charged a bomb for their treatment, thousands of dollars in medical bills, or they could have gone to a traditional government hospital, which are now running out of resources. So a facility like this would go a long way towards solving the ailments of Delhi's public.
Okay, many thanks for that update, Ishan Garg, speaking to us from New Delhi.